Welcome to the Military Health System Access to Healthcare Analysis Portal Overview video. The Rand National Defense Research Institute was contracted by the Defense Centers of Excellence for Psychological Health and Traumatic Brain Injury to conduct a study. The purpose of the study was to assess the amount of U.S. military service members and dependents that were located geographically distant or remote from behavioral health care facilities. VSolvit was then contracted by RAND to help display the results of the study via a web-based mapping portal. VSolvit is an award-winning technology services company recognized multiple years in a row at the national level for its outstanding technology support and innovation. As mentioned, the purpose of this study was to assess the amount of U.S. military service members and dependents that were located geographically distant or remote from behavioral health care facilities. Remote is defined as greater than a 30-minute drive from military treatment facilities and behavioral health care services. Additionally, areas with low behavioral health care provider density, as defined by the U.S. Department of Health and Human Services, were also considered. The term remote is not necessarily consistent with rural areas of the U.S., but there is typically more than a 50% overlap between rural and remote areas with respect to Army National Guard and Reserve populations. The Military Health System's Access to Healthcare Analysis Portal provided by VSolvit is a web-based geographic information system which utilizes altered patient data, protecting sensitive information to display the results of the study by the Defense Centers of Excellence. This software also demonstrates how further analyses can support improved decision-making by Department of Defense healthcare policymakers, planners, and managers, as well as healthcare service providers. The portal can answer questions such as these. How many patients in the service area live too far from treatment facilities? What is the availability of public transportation in the service area? How many members of each branch of military service are in the service area, and are they active duty, reserve, or dependents? What percentage of the general population living within the service area is unemployed, uninsured, and/or living in poverty? The main feature of the portal is the Calculate Remoteness tool. The Calculate Remoteness tool provides information on military health system populations for the selected geographic area. With 3 easy steps, population statistics are generated for a user-defined geographical healthcare service area of interest. First, the user selects the Calculate Remoteness tool from the sidebar. Second, the user holds down the left mouse button and draws the area of interest with the pointer. Third, as the user releases the left mouse button, the selected area zip codes are highlighted and an information box appears displaying client population statistics specific to the selected area. Information includes a breakout of the client population living too distant from care facilities, as determined by the study. Additional data and analysis results provided by VSolvit are also displayed and include general population statistics on percent uninsured, percent unemployed, public transportation access ratings, and poverty indexes. Additional data layers were compiled by VSolvit and integrated into the Military Health Systems portal to provide a more holistic understanding of the military treatment facilities and their patient populations. The layers can be toggled on and off in any combination. Full metadata that details the source and content of each data layer is provided. Additional analyses were performed by VSolvit to provide more insight into the geographical distribution of client population and comparative health system performance. Average wait times for appointments can be tracked and displayed for the benefit of patients and executive management. This can aid in scheduling decisions and resource allocations. Displaying the military treatment facilities based on the level of remote population can highlight those facilities or service areas with the greatest need to aid in effective policy and planning activities. Spatially analyzing the data at the state and national level provides additional insight on population needs to politicians, health system executives, and policymakers. The Military Health System's Access to Healthcare Analysis Portal is the result of the collaboration between RAND National Defense Research Institute and VSolvit on behalf of the Defense Centers of Excellence for Psychological Health and Traumatic Brain Injury. If you would like to learn more about the Remote Population Study, the Analysis Portal, or our other technology solutions, please contact us.